as a golfer, shoulders can be a problem when you're golf swinging. You can have pain in the shoulder, in the neck. Sometimes you don't know if it's the neck or it's the shoulder, or is the pain going down the arm coming from the neck. We assess a lot of golfers, okay? My name's Kevin Christie. I'm a sports chiropractor, TPI certified. I'm here with Matt Close, who's a TPI certified trainer. And today we're going to discuss a couple common issues that we see with golfers, and then he's going to demonstrate a few things you can do to help prevent it, okay? One of the biggest things that we see right out of the gates with golfers is, when you go into your backswing like this, you really have to keep your head down. So if I extrapolate up, that's a turning of the head, right? So a lot of people don't think of the neck muscles or the neck turning, but when you do that rotation, you got to have some mobility in that neck, and sometimes it puts a strain on it. So that's a common issue that we see in there. So we like to assess the flexibility of the neck, flexion, extension, down that way, down that way. How is your full neck range of motion? Are you having any pain during that? So you can test that at home, right? If you have pain in those motions, or you feel like you're really restricted to one side, then you might have an issue. We would do a little bit deeper analysis on that, but that's something that's common. The next thing is the shoulder joint. If I'm a right-handed golfer, I got to really be able to set that shoulder like that and keep that elbow in. But am I getting enough of the internal external rotation? So let me demonstrate something with Matt real quick. I'm gonna have you face that way. I want you to get into the golf stance for me, okay? Just like that. Let's take this arm here. We're gonna place it just like that. Good. And want to see your external rotation. Perfect. Now let's stand up tall and go into there. You can see that's pretty good external rotation that we're looking for. A lot of times what ends up happening is, even in a standing position, you can only get to here. We'd really like you to get to past 90 or past, and then from that way, when you get into the golf posture, go ahead again, it's going to get restricted there. He does really good, so I'm going to stand up. I'm demonstrating perfection there, really good mobility in the shoulder, but a lot of times people get really rounded, okay? Sit at a desk all day, live life like this, and then they bring that into their golf swing, and what ends up happening is they get restricted here, okay? Now, if I stood them up in a good posture, it would open up well, but they get closed off on that. So those are a couple things that we try to assess. You could probably relate to it, and there are a few things you can do to help prevent it. I can't give you advanced things. He can't either. If you're having pain in your shoulder, neck, anything radiating down the arms, I highly recommend seeking a professional opinion medically to get some clearance on it before you do some exercises. But these are some really easy ones you can do to try to get some mobility in those areas. So Matt's going to be kind enough to demonstrate a few things that you can start implementing right now to try to help prevent it. Again, this is for prevention. If you're having pain, seek out someone that can evaluate it and give you a treatment plan for it.
All right, as Kevin discussed, the neck and shoulder is very complex, and there's a lot of moving parts that's going on, especially when you're playing golf. So here's 3 exercises that's definitely going to help you to release the muscles and obviously help to strengthen it as well. So the first exercise is going to be a tall kneeling neck stretch. So first, what we're going to do is we're going to extend our arm out to the side. We're going to externally rotate our hand, and we're going to bring our wrist back. All right, we want to maintain that because we're going to open up the right pec on this side, and then we're going to do a lateral flexion. We're going to bring our left hand on top of our head, and we're going to slightly bring our head down towards the ground, and we're going to feel a stretch all through our neck. When you get done with that, you're going to relax. You're going to bring your arm back out. Same thing, externally rotate, bring the wrist back. Now we're going to go into flexion. We're going to bring our neck towards our chin, pull on top of the head, and just slightly pull. You don't want to do a very aggressive pull. You want to be very gentle when you're stretching your neck. You're going to hold each exercise for about 10 to 15 seconds. When you're done with that, then we're going to stretch our pec. So you could use a Swiss ball, or you could do this standing and use a door frame. So what I'm going to do is I'm going to get back to this 90-degree angle. I'm going to put my left hand down. My right arm is going to be on the ball, and I'm going to push my chest down, and I'm going to rotate my head to the left. And I should start feeling a stretch in my pec. If I want a bigger stretch, I could take my right leg, I could place it behind me, and I can go a little bit deeper, keep on rotating, and get a deeper stretch. So once you stretch your neck and your chest, now you want to strengthen it. So we're basically programming our software. We relaxed our muscles, and now we want to strengthen it so we can remember that. So what we're going to do is we're going to lay on our stomach, and we want to maintain pelvic tilt. So we don't want to arch our back. We want to flatten our back, and imagine that I have a piece of paper underneath my stomach, my belly button. I'm going to maintain this pelvic tilt. I'm going to bring my hands out to the side, 90-degree angle. Make sure we have neutral cervical spine. I'm going to squeeze my glutes. I'm going to raise my hands up, squeeze my scapula together, my shoulder blades, bring them back down. I'm going to bring them back up and back down. You're going to do this exercise 3 rounds for 10 to 15 reps. And those are your 3 exercises to do. Hope you guys enjoy them.